So is going to be what I'm going to talk about is that how to distinguish what is presented to us as allergy. So a lot of people feel they have allergy. People come and say, you know, I have an allergy. What they mean is they've got a rash. I hope that with this talk I can give you an overview. I will first talk about hypersensitivity mechanisms, then signs and symptoms of different types of hypersensitivity which can present to allergy departments. It's mediated through mast cells, and we'll talk about as well. The other hypersensitivities, type 4 can also mimic and appear to us or come to allergy clinic, and it's something to distinguish from type 1 hypersensitivity, and it's not mediated by IgE, and it is T-cell mediated, and it's called delay type hypersensitivity. The other two usually don't present to us in allergy departments, although in some forms or shapes can sometimes. If it's C1 esterase inhibitor deficiency or hereditary angioedema type 1 or 2, your C4 levels are usually, well, should be low during attacks and sometimes in between attacks. But you might find that's normal, but the patients still have recurrent attacks. Your history is not suggestive of allergy. They're not on ACE inhibitors. Then yes, they truly have swellings. Then you test by treating them with antihistamines. So there is urticaria angioedema that we talked about. There is a type of urticaria angioedema which is actually syn urticaria. It's only pure angioedema. So that's called, we call it, first we start calling it by idiopathic angioedema when we don't know what's caused it, but that idiopathic angioedema could be responsive to antihistamines, and that's not bradykinin mediated, although there might be some evidence that some bradykinin mediated, but I don't want to complicate this. Antihistamine responsiveness. So you try high doses of antihistamine for a good bit of time, 2 to 4 weeks. If they respond to it, then it's not bradykinin mediated. steroids, as George said, depending on really, it could be any of those things that you have to do.
So for those who are not responding to itchiness for antihistamines, there isn't any other medication which can reduce antihistamine, but just to give the holistic emollient, what you said just now, with the eczema treatment itself, that might reduce the itch.
To make the eczema better, basically. Yeah. There are other people who have intractable itch. There are clinics which do just itch, and there are various drugs that can be used for that, but it's not something we use routinely, and I don't do that. I would refer them to St. Thomas's Itch Clinic if I have to.
Yeah, thank you so much.
Okay, thank you very much. Thank you for an interesting talk and very interesting questions as well. Thank you, Serena. And I will leave on the screen some information about the Imperial College. I think I have it here. Yes, I will share it with you. There are Imperial College organizes postgraduate courses, both. I'm not sure whether you can see it.
No.
Here we go.
Oh, yeah.
Yeah. So they organize these postgraduate short, intensive 2-day courses, certificate, diploma, and MSc, and they are very, very helpful. They're very useful, and I'm an MSc student myself, and I found it very, very interesting and very, very good to build my foundation of theoretical knowledge in pediatric allergy. The other thing I wanted to remind you is the learning pack. So Ain has posted in the group before, in the group chat, the link to the learning pack and to the feedback for this evening session. So the session will be on the YouTube channel as well of the London School of Pediatrics. And that's it. Thank you very much and have a good evening.
Thank you.
Thank you.
Thank you, Serena.
You're welcome. Bye.